Daniel Opoku has been monitoring events there with regards to a follow-up on the fire that burnt the pharmacy department yesterday, and also we brought you the story yesterday of the labor issues where a number of workers there say that they are going to demonstrate against issues concerning their salary. So yes, Daniel Opoku is there. Daniel, what are you gathering with regards to the fire yesterday that gutted the place yesterday?
The Government and Hospital Pharmacists Association Gospel. What we have been told currently is that he's already receiving treatment, and although he's at a theater where doctors are briskly working on him, the signals we are currently picking is that members of Gospel are not happy with what happened yesterday. And currently we have caught up with the current chairperson or chairman for Gospel, Mr. Stephen Kokwe, to tell us some of the major problems that they think didn't go well before the fire outbreak. Good afternoon, Mr. Kokwe.
Good afternoon.
Now, Mr. Kokwe, my first question to you, we understand Gospel is extremely not happy with regard to what happened yesterday.
Yes, we are not very happy because yesterday when the fire broke out, a lot of our members have to flee for their lives. And as we said earlier on, one of them have to sustain serious injury and have to be rushed to the accident center. And it's becoming an alarming for us because we think that we came to work to provide service to our cherished clients. And if in the course of our duty, we have to face with these fire outbreaks, it will actually disturb our work. But having said that, I think that we need to investigate and ascertain the cause of this fire so that our minds will be clear as to the cause of this fire. Because seriously, there have been a lot of fire outbreaks in medical installations. Quite recently, we had a fire outbreak at the main central medical stores, and a lot of our members were asked to set aside for investigations to be done. We want to make sure that this cause of fire have been ascertained by the fire service, and then we will come to the bottom of what actually caused the fire in those institutions. And for this one, we want as early as possible to ascertain the cause of fire so that our minds will be clear as to what caused the fire in the first place.
Now, Mr. Okwe, the Drug Information Center, we understand other health professionals also come there to assess how the drugs are supposed to be administered. Now, documents have been burnt. What steps are you adopting to revive this Drug Information Center?
In fact, it's a very unfortunate situation. This is one of the big drug information centers in the country which have been burnt. Most of these hard copies of information has been burnt. The computers that are actually there has also been burnt, and I don't know, it will take some time before we are able to replace most of these information which are necessary to make sure that we provide unbiased drug information to most of our clients, and more importantly to our healthcare professionals, doctors, nurses and pharmacists also nationwide.
Now currently your members do not have offices to operate, and it appears they are lingering around. Is that worrying to you? If it is, what are you doing now?
Yeah, it is a very worrisome situation. You remember that the Drug Information Center also have the staff who provide services around the clock. Then we have also the clinical pharmacy unit where Mr. Raymond Tete, he is one of our past president who resides there. His office has also been burnt, and the common room that we all go there and have our snack or whatever has also been burnt. So currently those offices, those who are actually working in those offices doesn't have any place now. And as I speak now, the other offices there at the top two cannot operate because we are waiting for the fire service to come and make a detailed investigation to find out the cause of the fire, and that will take some time before those other offices up there can also start operating.
Thank you very much, Mr. Kokwe. As Mr. Huwe just rightly pointed out, all those offices up there are currently not operating because officials from the Ghana National Fire Service have more or less prevented everybody from going upstairs. Maybe they'll be tampering with investigations. So currently they are there doing their work, and members are more or less just battling with other people to be able to do what they would like to do, and also be administering drugs to patients. The situation has normalized. Patients are thronging in to the other department to collect their drugs so that they could also go through the normal treatment. So basically, things are normal here, although there has been fire outbreak. We have also been told that Mr. Raymond Tete is in a stable condition, and hopefully, maybe by next week, doctors are likely to discharge him. From Korle-Bu Pharmacy Department, Daniel Opoku, TV3 News.